Yeah, madam. Hello? Yeah, madam. Madam, ఒక 5 minutes వెయిట్ చేద్దాం మేడం. అది మేడం. డన్ మేడం. మన ప్రాజెక్ట్ ఆఫీసర్ ఉన్నారు మేడం సార్ ఇంట్రడ్యూస్ చేస్తారు మేడం. లెటర్ ఆన్ మీరు స్టార్ట్ చేయొచ్చు మేడం మీ సెషన్. ఓకే మేడం, థ్యాంక్ యూ మేడం. సార్ నమస్తే సార్. సార్ మీరు మీటింగ్ ఉన్నారు డివి సుబ్బనాయుడు. బట్ ఏంటంటే మీ డిస్ట్రిక్ట్ నుండి ఇంకా అంటే మిగతా వాళ్ళు కూడా ఫాలోఅప్ చేస్తారన్న ఉద్దేశమే చేశాం సార్. ఎస్ సార్. ఒక మెసేజ్ పెట్టండి సార్. మళ్ళీ కూర్చోండి, ఫోన్ అయితే వద్దు సార్, జస్ట్ మెసేజ్ పెట్టండి. ఓకే సార్, థ్యాంక్ యూ.
We are battling with this novel coronavirus, and we know that within a short span of time, COVID-19 has become a rapidly spreading communicable disease. Hence, WHO declared it as a public health emergency of international concern. And we are all seeing in India that India has been experiencing a massive surge of COVID-19 cases and deaths. And if you see the statistics of COVID-19 cases and deaths, this year, recently, as on April 10th, India is the third leading country based on the identified cases. And it is very sad to say that our state, Andhra Pradesh, is one of the major affected states in India. And last year, we suffered with first wave of coronavirus. And now we are facing the second wave of COVID-19. Since the middle of the March of this year, this second wave has started, and now today the highest number of cases has been identified in India, including our state Andhra Pradesh. We relaxed after first wave, declining the cases in the first wave, and having failed to adequately prepare for the second wave of coronavirus infections. Now our health authorities as well as our government is warning us, the people of India, of the possibility of third wave soon. And India is the most vulnerable to third wave of coronavirus, and we, the people of India, should continue to follow the precautions even after the cases began to decline. And before starting our theme of today's webinar with regard to nutrition, I would like to brief out about immunity. Because, for any kind of disease or any kind of nutritional problem, there are a part of our body or a particular system of our body is affected specific to a particular kind of disease. So whenever we are taking care of particular disease to overcome or manage or to treat the disease, we must know about what system that actually is affecting in our body and how we had to repair, how we had to enhance the system to face that particular situation, to combat that particular disease. That is very essential for all the individuals. For this particular topic about COVID-19, the most affected system is our immune system. So immune system is not only affected in COVID-19, but as well as, the immune system is very powerful system in the body which can protect us from dangerous form of coronavirus and COVID-19 pandemic. And so dear audience, I just brief out with regard to the immunity and the immune system, so that after finishing this particular session, you could able to understand your immune system, and accordingly you can follow the recommendations what are given by me in this session as well as by the health professional later in your lifetime. And let's see what exactly the immune system is and how immunity works towards combating this particular COVID-19. And we know that this coronavirus is very novel. Because of this novelty of the pandemic, because it is changing continuously the form of coronavirus by changing, but having various kinds of mutations, and it is showing various kinds of symptoms and different ways with the different segment of the people. And due to this novelty of this pandemic, the health professionals as well as the scientific community have been continuously doing research with regard to the effective vaccines as well as design and development of the perfect drugs for this particular COVID-19. But for the health professionals and the scientists, the biggest challenge is reducing the inflammation among the patients without compromising the correct immune response of the patient. This is the biggest challenge that they are facing. Hence, in this scenario, all medical professionals, including doctors as well as the science, should focus not only in effective drugs but also in nutrition. And the importance of adequate nutritional status and a perfect nutritional status and right dietary habits has been extensively highlighted during this COVID-19 pandemic. And we will have a brief look on our immune system. So we all know that the body's system of defense against any foreign material is immune system, and the body's ability to recognize and eliminate the foreign material, including the pathogen or any bacteria, fungi, or any kind of parasites, etc. That is immunity. That is our immunity. Our immunity and immune system, it recognizes the foreign invaders like the pathogens and other parasites and foreign material and take immediate action. So when you see the process of immune system, how the immune system functions in our body, you just see in the pic that our body has an excellent immune system. So we have various kinds of cells and the organs which are having immunity cells that are fighting against the invaders. I mean, they are fighting against the foreign material and protecting us from infections. Our immune system is the best defense in any kind of infectious environment. So why these particular infections and communicable diseases are spreading this much is, as long as our immune system runs smoothly, we do not notice any kind of infections like regular flus, cold, or any kind of infections, even including COVID-19. But if our immune system weakens, if we have very weak immune system, then we are more vulnerable to infections, and specifically with reference to COVID-19. And briefly I will explain how our immune system works to fight against this dangerous virus. All human beings, we have two types of immunity. One is innate immunity and adaptive immunity. Actually, if science people, that actually we have three types of immunity, but I am not talking about the third type of immunity because it is not required for this particular case. So we just discuss about two very important types of immunity which are very, very essential with regard to the COVID-19. This innate and adaptive immunity is playing a major role in fighting against the coronavirus. So what is innate immunity is, in simple way, I can say that it is a natural immunity All of us are born with natural immunity. We have our body, our system is an excellent natural immune. We have very, very excellent natural immune system. That is known as innate immunity. We can also, in medical terminology, we can also call it as first line defense system, because this innate immunity, it protects from pathogens that are trying to enter our bodies. How it acts is, it achieves through protective barriers against the pathogenic organisms. So what are those cells and organs which are involved in this innate immunity? Or the first and very important thing is skin. When any foreign material wants to enter into our body, skin, the cells of the skin are immediately alert, and that keeps out majority of the pathogens. And if any foreign material or any bacteria or virus that want to enter through our nose or throat, etc., the mucus that is present in that particular organ, that traps the pathogen and it stops the pathogen to enter further into the body. So like that, in first line defense, skin, mucus and stomach acid, which is very powerful, that destroy majority of the pathogens in stomach. And enzymes, there are a number of enzymes are there in the body. These enzymes in our sweat and tear, for instance, that are help to create antibacterial compounds which protect us from foreign materials like bacteria, virus, etc. And like that, the immune system cells in first line defense that attack all foreign cells which are entering into the body. Like that, it protects us from any kind of infections. And if you see the second type of immunity, that is known as adaptive immunity or acquired immunity, and in a simple way we can also call it as active immunity. This immunity, we all the individuals, we develop this kind of immunity throughout our lifespan. This is system that learn to recognize the pathogen. It will recognize the pathogen and it will remember the pathogen, and it will fight against the pathogen whenever that kind of pathogen enter into our body, now or in future also. So this particular immunity, there are various organs. In previous slide I shown you that there are various kinds of cells and organs are playing active role in immune system. It are spleen, thymus, bone marrow, lymph nodes. So these are all regulated by the cells and organs in the body which have an active role in acquired immunity. So what happened, how it functions in the body is, when a foreign substance enters into the body, if suppose in COVID-19 cases, when coronavirus enters into the body, so what happened, these cells and organs, they create antibodies and lead to multiplication of immune cells that are specific to the harmful substance and attack and destroy it. Our immune system then remember that particular pathogen, remember that particular foreign material by remembering that substance specifically, so that if it enters again in future, these antibodies and cells are even more effective and efficient, and quickly they act and destroy the pathogens. Actually, this is the concept behind our immunization, our vaccine. So that's why government is continuously asking the public to take vaccines to protect yourself from coronavirus in future. Vaccines, after vaccination, the antibodies are developed and they will actually remember that particular form of virus. And if you are in future, if you are affected with coronavirus, immediately the antibodies recognize them and start working towards it, destroy it and protect you from serious complications which are happened because of this dangerous coronavirus. And this is actually the function of adaptive immunity in the body. So okay, now we know that we have very excellent immune system, and even though we have excellent immune system, why people are suffering with various kinds of complications because of this COVID-19, because you know, um, screen visibility point. We are observing in the society that a few particular segment of people are suffering with very mild symptoms, and they are easily recover from coronavirus. At the same time, few particular segment of the people are suffering with very complicated kind of symptoms and lot of complications. Even deaths are happening because of the same coronavirus. So why this is all happening? With the same form of coronavirus, that is acting differently with different people, because the individual it depends on individual immune system. So if your immune system is very weak, then you are more susceptible to any kind of infections, including coronavirus. So what are the factors that weakens our immune system? Because nature gave us very excellent kind of defense system for all of us. But what happened? Few people are suffering a lot, and few people are coping up with the problem because it's your immune system. If you are if you have there are few certain factors that are playing a role in your immune system that weakens the immune system, then you are very susceptible to any kind of infections. So there are many factors are there which weakens the immune system, but I will tell you very important and very significant factors which playing a role in COVID-19. Here, if you see my screen, there are a few factors that I am mentioning, that poor diet and aging, lack of rest, and stress, both physical kind of stress or emotional stress, and exposure to toxins, that is either kind of toxin, environmental pollution, air, water, food, or any kind of pollution, the toxins enter into our body. And these are the major factors which are playing a role in our immune system, that are weakens our immune system. So here we will come to exact topic of our webinar, role of nutrition in immunity. What is the link? What is the role of nutrition? Healthy diets or contributing to the pre-existing condition actually, which worsening most of the people, that puts them more at risk during this COVID-19. And I can say that, of course, nutrition has an important role. Why my screen is, somebody is sharing their screen, so there is a lot of disturbance. I'm sorry. And though nutrition has an important role in supporting our immune system, so I can also say that, because till now with regard to the COVID-19, no research evidence that proves only nutrition could prevent or lessen the effects of COVID-19. But nutrition has an excellent role, very significant role in supporting the immune system. Prashant.
Madam, can you please close
actually,
all the windows,
somebody
madam?
is sharing their screen, and I am missing my screen actually.
యా మేడం జస్ట్ మినిట్ మేడం మీరు వీటిలోనే ఉంది కదా ఆడియో, ఓకే మేడం మీరు ఏంటంటే మీ దాంట్లో ఇది కాకుండా ఒక 2-3 ఐటమ్స్ అయ్యి ఓపెన్ చేస్తున్నాయి మేడం, దానివల్ల డిస్టర్బెన్స్ వస్తుంది. అండ్ వన్ మోర్ థింగ్ ఏంటంటే మేడం, పార్టిసిపెంట్స్ అందరికీ మైక్స్ ఆఫ్ చేసాం, వీడియోస్ ఆఫ్ చేసాం, షేరింగ్ పర్మిషన్ ఆఫ్ చేస్తాం. ఓన్లీ మీ ఒక్కరికి ఉంది మేడం పర్మిషన్. ఎస్ మేడం, బ్యాక్గ్రౌండ్లో సంథింగ్ రన్ అవుతున్నాయి మేడం, అందువల్ల మీకు డిస్టర్బెన్స్ వస్తూ ఉంది మేడం. మేడం నేను చెప్తాను, ప్లీజ్ ఫాలో మై ఇన్స్ట్రక్షన్ మేడం. కంట్రోల్ షిఫ్ట్ ఎస్కేప్ మేడం. ఎస్ మేడం. నో మేడం, స్క్రీన్ షేర్ చేస్తూనే చేస్తే మీరు లైవ్లో ఉన్నారని తెలుస్తుంది మేడం. ప్లీజ్, నాకు తెలుస్తుంది అక్కడ ఏం జరుగుతుంది. స్క్రీన్ షేర్ చేయండి మేడం. చేస్తే నా కంట్రోల్ షిఫ్ట్ ఎస్కేప్లో నేను ఇక్కడ ఏమేమి జరుగుతుందో నేను చెప్తాను మేడం. ప్లీజ్, దట్స్ ఓకే మేడం. ఓకే, సో హౌ మెనీ కంట్రోల్ షిఫ్ట్ ఎస్కేప్ మేడం. ఇట్స్ ఎ కాంబినేషన్ ఆఫ్ కంట్రోల్ షిఫ్ట్ ఎస్కేప్. ఎస్ మేడం, shift escape madam, all together. Just a minute madam. Process Teams, task manager, Chrome madam. Is there any use of Chrome madam? Kindly close it madam. No madam, click on that Google Chrome madam first of all. Later on end task madam. End task done. 1 2 3 done madam. Idi close chesandi madam. There ends madam. Yes madam, you can continue your session madam. Yeah madam.
So nutrition has a significant role in enhancing our immune system to protect any kind of infections, including COVID-19. Hence, dear audience, nutritional status, good nutritional status is very, very important. Very, very important to maintain a strong immune system against the virus. And as a nutritionist, I can suggest to all of you that it is mandatory to attain and maintain good nutritional status to fight against virus in this particular pandemic. And now a question arises in our minds, because the Prashant muted all your microphones, so I'll ask your question from my side. Okay, the question is can our diet or food be used to aid the body to build or boost immunity? If anybody asks this kind of question, as a nutritionist, I can say that yes, 100% true, because you must understand and accept the healing power of food. Because this concept is not new to us. In India, since generations, our culture, our traditions, our diets particularly, our traditional diets are consisting lot of medicinal properties which are protecting since years with many kind of infectious diseases as well as metabolic and any kind of lifestyle, metabolic or any kind of diseases. So now we are changing our dietary habits, and we are our younger generation are very interested in changing their dietary habits to Western kind of diets. So thus this particular situation leads to many kind of lifestyle and metabolic diseases in recent years. Otherwise, our Indian traditional dietary system, we have an excellent dietary components, bioactive and functional components that can protect us from all kind of infections. If you see, and even not only India, worldwide the people are accepting the statement that food has the healing power. It's 100% true. If you see the sayings of Hippocrates, the great Greek physician, he said 400 BC back that let food be your medicine and medicine be your food. If you understand this particular statement very clearly, then you will never go into faulty dietary habits even in your future. Always you consider, you take very healthy food as your medicine, and if you want to take medicine for any kind of common problems, you take your food as medicine. This is very, very, very simple and very powerful statement, and we have to accept that today in this pandemic scenario, good nutrition is more important than ever, because it protecting us from coronavirus, and the protection from coronavirus directly related to what we eat today. And okay, we know that nutrition is very important, and there is lot of significant role in nutrition to overcome the infections during this pandemic. So how we have to put all these principles into practice in our day-to-day diets, in our day-to-day lifestyles? How we have to modify our diets, how we have to enrich our diets with nutritious tips and nutritious principles, that we will see in further slides here. And dear audience, that you have to know that not only this coronavirus, not only this COVID-19 and infectious problems, that common flus which are coming and going every year, every season, the seasonal kind of problems and other things, any kind of problem, nutritional problem or metabolic problems or lifestyle diseases. There are many lifestyle diseases are coming into wake during this past decade. So for any kind of disease or problem, with regard to nutrition, a healthy, balanced diet is only the key for maintaining good health and immunity. So what is meant by healthy, balanced diet? In recent years, past 2 years, we have a lot of information is available with regard to food and nutrition in mass media, social media, and everybody is talking about nutrition and everybody is giving suggestions and advices with regard to the nutrition. But if you follow the proper nutritious diet with proper nutrition principles specific to your problem, specific to your physiological status, with the guidance of nutritionist or dietitian or your physician, then you will never get a problem with regard to food or diet. So what is meant by this healthy balanced diet? So in a simple way I can explain that healthy balanced diet is the diet, your day-to-day diet must have a balance of all nutrients. So what are these all nutrients? So you are very familiar with these nutrients because last 2 months, we are continuously repeating, we are continuously studying and listening with regard to the micronutrients and importance of vitamin A, D, E, like that. What exactly this balanced nutrition is?
Madam? Yep.
Balanced nutrition is your diet must have contain a balance of all these nutrients like carbohydrate, protein, fat, along with vitamins and minerals, including water. If your diet is deficient of any one of the nutrient or multiple nutrients in this list, malnutrition will occur. So malnutrition is the most common cause of immune deficiency worldwide. Now we are facing that. And here then we will come to exact thing, that nutritional recommendations for COVID-19. Here I will divide my session into nutritional recommendations for COVID-19, during COVID-19, and nutritional recommendations for post-COVID-19 patients. Individuals, sorry, not patients, individuals. Here first we will discuss about the nutrition, importance of nutrition and nutritional management during COVID-19. And we know that COVID-19 is affecting people with various kinds of symptoms. A segment of people are suffering with very mild symptoms like raising the temperature and cough, cold, like that. And they are overcome the particular mild symptoms within few days, and they are perfectly come into normal situations after their quarantine, like 40 days or something. And few particular individuals are suffering with symptoms, mild symptoms, as well as difficulty in breath. So like that, some people are suffering with. So in what kind of food that is recommended for each particular case of COVID-19, let's see. And first, I would like to share the information with regard to nutritional management for mild symptoms. Because many people are, suffering with very mild symptoms and are in home quarantine, and they are taking necessary precautions and advised by the doctors and physicians, and they are taking proper care with regard to their diets and nutrition. So what kind of nutrition that we had to provide for the people who are suffering with mild symptoms like fever or sore throat, cold, cough, etc. So for anything, good nutrition is compulsory, a balanced kind of nutrition. So first we have to provide adequate nutrition, adequate food for the people who are suffering with mild symptoms. And don't scare about the situation of COVID, and don't feed your family member, don't feed your friend with lots of food, because if you feed overfeeding, so it's again give some other kinds of problems. So just provide adequate kind of food for the people who are suffering with mild symptoms. And you, instead of giving large meal, because we, particularly the South Indians, we are habituated to 3 large meal: breakfast, lunch and dinner. So instead of giving a large meal at a time during lunch or dinner, because during COVID, people are giving all kinds of foods at a time. So don't give that kind of diet for the patient. So you give, instead of giving large meal, you can divide the quantities and you give frequent intervals, either 5 meal a day or 7 meal a day. In between breakfast and lunch, you give small snack at mid morning, and you can also give during snack time or mid evening, and bedtime you give some kind of liquid or beverage. So like that, you just provide the patient the frequent intervals of meals rather than large meal at a time. And the next one is, always we have to provide variety of the foods, because actually many of the people who are suffering with COVID-19, they lost their senses like taste and smell. So when we lost the senses of taste and smell, it's very difficult to accept the food. Whatever the food that we are providing, whatever the tasty food and very very good food that we are providing, so without smell and taste, it's very difficult to accept the food. So for that, we have to improve the appearance of the food. You give variety of the food in their lunch, variety of the food in their dinner, very colorful kinds of. You include 2 or more colors in their lunch plate or dinner plate or breakfast plate, that will attract and they consume the adequate quantity of the food. So include variety of the foods for acceptance as well as to provide enough nutrition for the people who are suffering with mild symptoms. And cough and sore throat are the common symptoms for many of the people. So if they are suffering with either cough or sore throat or both, we have to provide the soothing foods like warm liquids, either warm water or warm flavored water with herbs, or warm water with spices and condiments, so green tea or dal soup. Like that, we have to give in between the warm liquids like as soothing foods to relieve from the sore throat or to relieve from the cough. And try to use more culinary spices and herbs that might be beneficial. Because even the government and AYUSH is encouraging all the people in India to use more spices and herbs, to include more culinary spices and herbs in our diets, because it's not new to us. Our Indian system, we are using many herbs and spices in daily diet. You try to incorporate all those things in all kinds of foods to garnish or to incorporate in your tea and other things, so that you can the patient can have relief from the sore throat and cough and cold. And always increase the consumption of fruits and vegetables, because the vitamins and minerals which are very essential to to fight with the virus, those are available in fruits and vegetables plentifully. So fruits and vegetables increase the amounts, because fruits and vegetables also contain a number of antioxidants which are very essential to fight against the virus. So give number of fruits and vegetables, at least 500 grams per day. We can provide fruits and vegetables for the people who are suffering with mild symptoms. And apart from the nutrition, we have to provide holistic kind of environment. We have to allow them to sleep properly. At least 10 hours of sleep is very essential to enhance our immune system, to work our immune system effectively. and allow them to sleep properly and reduce stress and follow any kind of simple exercises, yoga, pranayama, to get rid of the stress during the COVID-19, and particularly avoid, if the people are habituated to either alcohol and tobacco, and ask them to avoid the intake of alcohol and tobacco products. And these are the few recommendations that we had to follow during mild symptoms of COVID-19. And some people are having mild symptoms like fever, cold, and cough, and other things, but they are also suffering with dyspnea, which is known as, in simple words, that we can say that shortness of breath. And if shortness of breath is there in the patients along with mild symptoms, nutritionists, we generally adopt certain kind of modifications in the diets of the people to relieve from the shortness of breath. So what are those modifications that we have to consider in the the patients who are suffering with breathlessness during COVID-19 with mild symptoms, I am saying. If they are suffering with very complicated kind of symptoms and very serious kinds of breathlessness, then immediately we have to hospitalize the patient, and it has to be supervised by the doctors and the nutritionist in the hospital. And when the patient is in home quarantine with mild symptoms with shortness of breath, that we can modify their diets to facilitate the conditions to relieve from that particular symptoms. So what are the nutritional modifications that you have to do in the diets of that particular people? Are just reduce the carbohydrate quantity. And in our South Indian diet, at least 50% of our calories are coming from carbohydrate. Generally more than 60 to 65% is coming from carbohydrate. So if the person is suffering with breathlessness or any problems with the shortness of breath, then you reduce the carbohydrate quantity. And whatever the carbohydrate that we are giving to the diets of the patient, you are more conscious about the kind of carbohydrate. Try to include the foods which are low in glycemic index. I will explain in further slide about what exactly the foods are. You just reduce the carbohydrate quantity to facilitate less RQ generated, because this is very important. If the person is suffering with breathlessness or difficulty in breathing, it's very difficult to consume the food and having the right amounts of the food, etc. So the simple modification that we can do in the diets of the people, so then they will easily overcome with that problem, respiratory problems. So if you reduce the carbohydrate intake, we have to compensate the calorie requirements with other nutrients like fat and protein. And for this particular condition, you just increase the fat requirements, because we have to increase the fat requirements, but the kind of fat that you are choosing is very important. Don't give the saturated kind of fats and trans fats and bakery foods and other kinds of snacks for fat requirement. We have to give healthy fats like nuts, seeds, and fish, nuts like walnuts or any kinds of nuts which are rich in omega-3 fatty acids. That kind of fat that we have to include it, because fat facilitates them to less RQ generated, so that they can overcome with that problems. And again, the other important nutrient is protein. Give good sources of protein to compensate the calories which we restricted the carbohydrate. When we are restricting the carbohydrate intake, we have to provide the calories from protein and fats. And the other important nutrition is vitamin, mineral, and trace elements. Everybody is aware of this particular thing, because a lot of demand is occurred in India, not only India, worldwide. I think some particular season, vitamin D and vitamin E tablets are not at all, even vitamin C supplements are not at all available in medical shops. So you are having enough awareness with regard to um, vitamins and minerals. Vitamins and minerals. So vitamins and minerals, the multivitamin and trace minerals are very important because it increase the antibodies production and functioning of T cells and B cells, which are playing a major role in our immunity. So multivitamin and multi-mineral supplement is providing it's just recommended to all patients, even including with the patients who are suffering with the mild symptoms in COVID-19, just as feeding regimen. Doctors are prescribing, and you just take we just provide that particular supplement for the people who are suffering with COVID-19 till they are recovered with their symptoms. Then they will follow the natural kind of diet which is rich in the particular nutrients. And sometimes, according to the symptoms, according to the health status of the individual, doctors are giving more quantities of these multivitamin and mineral supplements when compared to the ODA. That it has to be, whatever the supplement that the doctors are suggested, it has to be taken by under the supervision of either your physician or your under the supervision of your physician or your nutritionist or dietitian. And other important aspect in our nutritional recommendations is water. Water. All individual must take care of your fluid status. Just to keep hydrated throughout the day, throughout your quarantine, throughout your recovery from the COVID-19. Try to hydrate with plentiful of fluids. Not only with water, take light soups.
మేడం ఇది పీపీటీ షేర్ కావట్లే మేడం. ఎస్ మేడం. Yeah, done madam. Done madam.
Thank you. So, hydration and nutrition is playing an important role in body's response and recovery from COVID-19 symptoms. Enough water and take clean water or any kind of soups or juices like that, and keep hydrated throughout the period. And then we will go for nutritional guidance during recovery and rehabilitation. After recovery, still many of the individuals are suffering with a lot of symptoms like fatigue and weakness are the major symptoms that many of the individuals are suffering with, and few of them are with body pains. Even after they are joining into their workplace, they are continuously facing the problems like weakness and fatigue and body pains, and people are asking for nutritional advice to overcome with that particular symptoms after COVID, post-COVID period. So what are the care that we have to take in post-COVID period is also very important. Don't relax after your quarantine. So even after your quarantine, so until you become very health and fit, you just to follow the nutritional recommendations. You continue the nutritional care throughout that period until you become very healthy and fit. And many nutrients are playing major role in recovery of the patient after COVID. So one of the very important nutrient is protein. So why I am stressing protein? Because protein is very, very essential, not only for growth and development of the body, for repairing the system, for the managing of various cells and organs. Every cell and organs are rely on protein. So protein is not only all cells and organs, with special reference to immune cells and immunity system is totally rely on protein for synthesis of antibodies and T cells and B cells and functioning of all the cells. So for all these things, for effective functioning of immune system, protein is very essential. And in our Indian diets, particularly our South Indian diets, we are very neglecting with regard to the protein. But we had more concentrate on protein during post-COVID period. If your diets are deficient in protein, it leads to the symptoms what I said earlier, like weakness, fatigue, apathy, and body pains. These are all because of protein deficiency in the people during their post-COVID period. So why? Because many of us are vegetarians and we have a lot of myths and beliefs with regard to various foods, and we have a lot of food habits and cultures. So we are neglecting some kind of nutrients like protein and vitamins, etc. So proteins are not only available in very expensive and sophisticated kinds of foods, what celebrities are advising, what people are saying in social media and the mass media. So protein is also available in number of sources, which even the low socioeconomic people, everybody has to afford the foods which are rich in protein. So whatever the foods that you can afford and whatever the foods that are available within your system which are rich in protein, you just include in your diets as protein requirement to meet the demands of the protein for your body during post-COVID period. So proteins are plentifully available in all animal sources. If you take milk and milk products, egg, meat, fish, every animal food is very rich in protein. Of course, those are very expensive. If you can afford and you are non-vegetarian, you can include small quantities of animal protein in your diets. So no problem if you are not having that much of affordability and you are vegetarian. There are plentiful of plant foods are rich in protein. So we have to select, we have to choose the protein, the good protein, the right kind of sources into our diet. Then we can easily meet the demands of the protein. All the lentils, legumes and dals are very rich in protein. Whatever the dal that is available to you, and at least include the dal for 2 servings a day. If you add 2 servings of dal in a day, I am giving the protein values here. You can easily get 12 to 15 grams of protein with just 2 servings of dal in a day. And you can add at least 150 ml of milk, 2 glasses of milk that is essential for normal health, at least 150 ml, you will get easily 5 to 6 grams of protein. Like that, whatever the vegetarian food and millets, you can add millets, you can use nuts, not only the expensive kinds of nuts like walnuts, almonds, you can also have our peanuts and flax seeds, which are very rich in protein. You can have number of seeds which are rich in protein. So you can include even the plant sources of protein to meet the demands of your body with regards to the protein, because protein is very, very essential. If protein is deficient in your diets, your immune system immediately weaken. It's very difficult to fight against the situation. And the next important nutrient is carbohydrate. So carbohydrates are the major part of our diet. We are habituated to our South Indians. We are very habituated to certain kind of diet which is rich in carbohydrate. So I am not saying to change your carbohydrate and avoid carbohydrate, because carbohydrates are very, very important, because it is the very prime source of energy. So but choosing the right kind of carbohydrate, right kind of food which is rich in complex carbohydrate, that's more important. Try to include complex carbohydrates. The whole grains that you include. So instead of taking rice throughout the day, you just take a part of the rice as well as a small millet or whole wheat flour roti or chapati. Like that, you include 2 to 3 grains throughout the day, which are rich in fiber, and include starchy vegetable and fiber-rich fruits, green leafy vegetable, more green leafy vegetable into your diet. That will give complex carbohydrates which are help the immune system, because these complex carbohydrates, which are rich in fiber, they just eliminate the toxins which are present in the body. It helps, it facilitates the body to eliminate the toxins from the body. So then the immune system will be very active and it will work effectively. Try to avoid simple carbohydrates, not only in COVID-19 period, throughout your life, and whatever even the children or adolescents or old age, we the adults, everybody try restrict the amounts of simple carbohydrates from your diet. Instead of simple carbohydrates, you can include more complex kind of carbohydrates which are very healthy, and it will provide the sufficient calories for your body. And the other important aspect of our nutrition is fats. And we have very myths and beliefs with regarding to fats. And people are generally perceived that fats are not healthy, fats are not good for the body, and fats are very bad. In general context, there are no good and no bad foods. All the nutrients are very essential for proper functioning of your body to keep you to become healthy and fit. And fats are also playing a major role, an important role in modulating immune function and even in the inflammatory processes of infections or any communicable disease. But choosing the right kind of oil, that's more important. So you just restrict the amounts of more saturated oils and restrict trans fatty fats like vanaspati, etc. Instead of it, you can increase healthy fats. But a simple recommendation that I can tell you as a nutritionist is that you just maintain the ratio of types of fat in your daily diet in the form of 1:1.5:1 of saturated, monosaturated and polyunsaturated respectively. And we have plentiful of sources for saturated fats, and you can pick monosaturated fats either from rice bran oil or safflower oil or olive oil. That will provide monosaturated, and polyunsaturated you can pick sunflower oil, or you can also pick soybean oil, or you can also take corn oil. So like that, you can, instead of taking a single oil, one oil throughout your month, you just change the oil every week. But don't mix the oils in one particular bowl and use. That kind of practice is not good again. For 1 week, you just use one particular oil, either safflower or sunflower or groundnut or sesame, any kind of oil. Next week you change, you go for another kind of oil. Like that, you use all kinds of oil that will facilitate us for proper functioning of many organs in our system. And coming to the fats, in recent years, a lot of research is conducting by the health professionals in medicine as well as in nutritional science with respect to omega-3 fatty acids. Because previous 3 to 4 decades, we all know that a lot of lifestyle diseases, the prevalence of lifestyle diseases are continuously increasing. So many lifestyle diseases like hypertension, cardiovascular cancers are prevailing more worldwide. So, what is the root cause of that particular problem? How to overcome the worsening situation of lifestyle diseases? People are continuously, the health and nutrition professionals are continuously doing research with regard to various components which have beneficial effect in reducing the severity of the diseases. So one such component is omega-3 fatty acids. Omega-3 fatty acids not only reducing the severity of non-communicable diseases like diabetes, hypertension and cardio. So these omega-3 fatty acids have lot of functional properties with regard to the immune system. It helps the immune system, it boosts the immune system by enhancing the function of the immune cells. So a lot of research is proved in this. And you can pick all the nuts and seeds which are rich in omega-3 fatty acids like flaxseed, almonds, groundnuts and chia seeds. And fish liver oil is very good source of omega-3 fatty acid, and fatty liver and many seafoods are rich in omega-3 fatty acids. You can choose any kind of food that is available and affordable by you which are rich in omega-3 fatty acid and include in your daily diet to enhance your immune system. And apart from this, there are many immune function boosting nutrients or gaining lot of importance during this pandemic. That nutrients, you know very well, if I ask you what are the vitamins that are very essential, what kind of vitamins that the people are taking during this pandemic, even the child can easily answer for my question, like zinc, people are taking zinc, people are taking vitamin A, vitamin C and vitamin E. Sometimes, you know, without doctor prescription, without advice, taking advice from the physician or nutritionist, people are taking the supplements like zinc and vitamin C to protect themselves from this particular coronavirus. But it's not that particular habit is not good. Always take the supplements with under the supervision of either doctors or the dietitian. But you can have these particular nutrients through your diet. The natural way of getting micronutrients, immune boosting nutrients like vitamin A, vitamin C, vitamin E and vitamin D, zinc, iron. So from the natural food, that is always beneficial and no risk factors and no adverse effects if you are consuming through the diet. And vitamin A, that is very important, and lots of research already prove that vitamin A is having beneficial role in promoting response to many bacterial infections, and vitamin A is having lot of significance because it plays a regulatory role in immune system which can help the body to fight against corona virus. So all fruits and vegetables, many fruits and vegetables. I'll give you simple tip for identification is any vegetable which is orange in color, yellow in color, and even green in color, you know, that particular vegetables are very rich in beta carotene. That it converts into vitamin A in the body, and eggs and dairy products. And fruits, all yellow fruits like mango, papaya, orange fruits like papaya and pumpkin. So these are all very rich sources of beta carotene. You just include number of such kinds of natural resources for getting vitamin A in your diet. Vitamin A will definitely help you to improve your immune system. It will definitely protect us from the infections, not only coronavirus, any kinds of seasonal infections. You just take more vitamin A content foods into your diet. So any vitamin in excess, you know, is always not advisable. Don't take vitamin A rich foods along with vitamin A supplements like that. So few particular nutrients, you know, that will become toxin, it will provide toxicity in the body. So you just take the supplements according to the advice that is given by your physician. And vitamin C. So there is nothing to say about vitamin C, that everybody is very much aware of this vitamin C. So even during this pandemic situation, you know, everybody is taking vitamin C regularly, candies. Though we are nutritionists, even our family, they don't listen to us. though we are providing a lot of vitamin C rich foods and juices and salads, they are taking that, oh, people are saying, doctors are saying to take vitamin C supplement, we will take vitamin C supplement. Vitamin C is of course very essential. We must take vitamin C. But natural kind of vitamin C is giving lot of benefits to strengthening our immune system. It's not very expensive. It is available in all kinds of foods and less expensive fruits and vegetables will provide plentiful of vitamin C. The seasonal fruits and vegetables, particularly in our state, Andhra Pradesh, India is actually we have plentiful of resources with regard to fruits and vegetables, and even we have in South India we have number of indigenous fruits and vegetables which are very rich in vitamin C. We just habituate to take one glass of lemon water every day, or you can have one orange juice every day. Instead of taking 3 to 4 cups of coffee and tea every day, you just skip 1 cup of tea and take 1 glass of orange juice or 1 glass of lime juice. Or if any kind of other berries, seasonal kind of vegetables are available which are rich in vitamin C, include that. And Amla is very rich source of vitamin C. You can have Amla. You can make various kinds of recipes with Amla, and you can have Amla juice, Amla candy. You just feed Amla candy to the children to improve their immunity. And vitamin D, this is a very important aspect that I have to tell you, because it's very pathetic situation that in India, we are depending on supplements of vitamin D. Vitamin D is naturally available through sunlight. Actually, if we want to say that vitamin D source is, the natural source of vitamin D is only sunlight, because the active vitamin D is in various forms like D2, D3. So the active form is D3, which is plentifully available in sunlight. You just have a walk for at least 30 minutes in sunlight. You can get sufficient quantities of vitamin D, because vitamin D is playing very significant role in immune system, because A vitaminosis, vitamin D deficiency, that is the major cause of many deaths of COVID-19. Okay. Because recent research that is saying that vitamin D deficiency is the major factor that is identified in many COVID-19 deaths. So you just imagine how important is vitamin D, because vitamin D has various kinds of functions, but we will talk only with regard to COVID-19. This vitamin D, if it is deficient in your diet, it actually limit the proliferation, it decreases the proliferation of B cells, which are very important in immune function, and even the T cell, a decrease in overall proliferation of T cell, and immune globulin production is decreased. So a lot of things, a lot of adverse effects will happen if vitamin D is deficient in our daily diets. I can say with diets, because don't depend on diet, because diets are foods, only limited foods are rich in vitamin D. Very small quantity, very few foods are having vitamin D. That too, vitamin D in the form of D2, less active form. So it again has to convert. We have to take more quantity of that particular food to get sufficient vitamin D. Instead of that, you just take the natural kind of vitamin D from sunlight. If we want to know about if we are deficient in vitamin D, because many individuals are deficient in vitamin D, and you can include mushroom in your diet, and if you are non-vegetarian, you can include fish. Fish, but is vitamin D, except the vitamin D, and dairy products, fruits and beverage, fruits and milk breakfast cereals are fortified with vitamin D. There are many fortified foods are available in the market. You can go and read the label properly. You can buy the fortified vitamin D rich foods from the market, and you can use as supplements for vitamin D. And vitamin E. Vitamin E is a powerful antioxidant. Particularly, it proves that vitamin D is very beneficial role, especially in elderly population. You know, in first wave of COVID-19, many old people, elderly people are suffered with first wave of COVID-19. In that particular cases, vitamin E plays a beneficial role. The supplementation of vitamin E that plays a beneficial role in strengthening the immune system of elderly. So vitamin E is available in seeds, nuts, and some vegetables like broccoli kind of family. And it can abundantly available in all nuts, oil, the fat. So you can incorporate the quantity that we require. The vitamin C is very huge quantity required. 7.5 to 10 milligrams that we require form of alpha tocopherol. So you can choose the proper source of vitamin E. You can include a handful of or a tablespoonful of nuts, whole seeds, or any seeds as a snack every day, so that you can meet your vitamin E requirements. If in COVID-19, if anybody is suffering with the complicated kind of symptoms, that particular person, he may require vitamin E in the form of supplements, that we can take the supplement under the supervision of our doctors and dietitians. And B complex vitamin. So B complex vitamin is a part of feeding regimen in all COVID-19 diets. So whenever a patient or individual is tested with positive, so along with his medication, doctors are giving one B complex, one vitamin E, and one vitamin C. So along with zinc, the very important trace mineral. So vitamin B complex has a strong role in immunity, and all our regular diet. So even this B complex vitamin we require very minute quantities. All our regular diet will provide this B complex vitamins, but you must have to take a balanced kind of diet. No, don't depend on only one particular food, rice throughout the day, and only rice with dal in 2 meals. So instead of that, you can include a variety of the foods, that whatever the foods that you can afford and available. So it will provide the daily requirements of your vitamin B complex. So all the whole grains are rich in vitamin B complex, and simple processing, care in processing is very much required to restore the B complex vitamins in the diet. And green leafy vegetables are rich in folic acid, and at least include 1 or 2 green leafy vegetables every day. And the only vitamin under B complex, the only subgroup which we have to focus, which we have taken care is about cyanocobalamin B12, because many vegetarian foods are very low sources of B12. So with the vegans and the vegetarians has to be very careful while meeting the requirements of B12. So for that people, you just include more fermented foods, yogurt, buttermilk, like that. So you can meet your B12 requirements with and mushrooms. That particular foods will give you the enough amounts of B12, and the remaining thiamine and riboflavin, our daily diet, particularly the South Indian diet, that we can have sufficient amounts of vitamin B complex. But if the people who are suffering with mild to severe symptoms, so they must take one supplement under the supervision of the physician and dietitian. And this is about vitamins. And coming to the minerals, iron and zinc are very important. There are many minerals are there, but because we do not have much time to discuss all, that's why during your treatment, during the whole quarantine period of COVID-19, doctors are prescribing multivitamin and mineral capsule to all the patients, so that the essential nutrients are meeting the demands of that particular individual. But after that, during post-COVID situations, when you start taking the supplements, you must know about the natural sources of that particular nutrient. We have to continue the dietary recommendations throughout the life for sustainable health and fitness and wellness in your lifespan. And iron is a very important nutrient in immune function, because it aids in T cell development. T cells are very important in immune system. They fight against the virus and they destroy the virus. Even if B cells are there in the body, B cells again depends on the T cells for to destroy the virus totally. So in T cell development, iron is playing a major role. So include more iron rich sources. Here again in iron, there is one small problem with regard to nutrition. That a small care that everybody has to take care with regard to iron. Actually, iron in the diet is available in two forms. One is heme iron and the other one is the non-heme iron. Non-heme iron is available in all fleshy foods, non-vegetarian foods. This iron is actually more absorbable. It is absorbed by the body very easily and effectively. So coming to vegetarians and vegans, iron from the plant sources. Of course, iron is available in many plant sources. But there is a small problem with plant sources is the other nutrients, non-nutritional things which are present in plant sources like fiber or tannins, phytates, etc. that are interfere with the iron in the body and or make unavailable the whole iron content whatever you are taking through your diet. It will affect the absorption of the iron, total iron in the body, if we are totally dependent on plant sources. In that particular cases, so a simple tip that we can follow is either you just increase your quantities with regard to iron sources if you are vegan or vegetarian, or along with the iron you can include vitamin C rich foods, any citrus fruit or any kind of vitamin rich food. You just add the food, club the food while making your recipe, or after taking iron rich snack or beverage or something, you can have one vitamin C rich drink or fruit. This vitamin C facilitates the iron absorption from plant sources. So iron is one such important nutrient for T cell development as well as functioning of proper immune system. And zinc, again like vitamin C, there is nothing to say about zinc because all the people are talking about zinc. Zinc is becoming very famous during this COVID-19 because zinc is very, very crucial for development of immune system as well as for effective functioning of immune system. Because zinc actually it stimulates the production of T cells and it stimulates the production of phagocytes, which are very essential for immunity. If your diet is deficient in zinc, immediately the phagocytosis is impaired and you have very low T cell and B cell, so that your body is unable to fight effectively with the any kind of virus or bacteria, including because it's very difficult if you are unable to fight the normal seasonal flus. So then the person is it's very difficult to fight with dangerous coronavirus. So zinc is very essential nutrient for proper development of T cells and B cells in the body, and as well as the functioning of immune system effectively in the body. And other important, apart from these, the regular kind of nutrients like carbohydrates, protein, and vitamins and minerals and other things, there is another few particular foods which are came into work during this COVID-19 and becoming very famous during this COVID-19. Or one such food is probiotic foods. And people are, when we just check our social media or YouTube, the people are continuously saying about a number of probiotic foods that have a beneficial role in facilitating our immune system. Probiotics are not in such a condition to prevent the COVID-19. You cannot prevent COVID-19 or you cannot treat COVID-19 with probiotics. Even the doctor, he is also saying that it will facilitate you. It will facilitate your immune system to work effectively. So include more probiotics, because in our traditional Indian dietary habits, probiotics are playing major role. So what are the various foods that comes under probiotics are any fermented foods like your curds, buttermilk, and yogurt, and pickles, vegetable pickles or fruit pickles, pickled vegetable and pickled fruits. So these are all known as probiotic foods. So include more probiotic foods into your diet. That will help. That will boost your immunity further to relieve from the various kinds of symptoms which the people are suffering with COVID-19. And the other kind of category of foods which are becoming famous during COVID-19 are spices and condiments as well as herbs. There is no adverse effects by taking all these foods, but you have to choose a proper kind of food, and you have to consider your own physiological system, because you have to understand if you have any pre-existing conditions like gastrointestinal problems or reflexes, acid reflexes, heartburns. In such cases, you have to very careful using very strong spice and condiments like pepper and other kind of herbs like ginger and other things. Don't take too much of spices, don't take too much of herbs. In the first wave, doctors are suffered a lot with gastrointestinal problems, because people are very scared about the situation, because that particular situation is very new to us. The coronavirus itself is very novel, and we do not understand what kind of complications that the virus is going to give. So we are very scared with that particular problem. And if some people are saying that herbs and spices and condiments have having beneficial effects in prevention of coronavirus, and people are eating too much of herbs and too much of spice and condiments, that leads to some kind of gastrointestinal problem. If you already having any acid refluxes and any ulcers or heartburn and such a kind of problems, taking too much of pepper and other things will definitely having adverse effects in the health of the individual. So for normal functioning of immune system, you can include the spices, and you can include the ginger. You can have the basil, the holy basil. Every home we are having basil, and we have turmeric, and try to include more turmeric. Have golden milk during bedtime. So this will have some effect, some beneficial effect and it also works as soothing foods in many of the beverages. You have decoctions, and you are also making tea with the herbs, and you can add as garnish powders in your regular food. That will help you in improving your immunity levels. And so I can say that this coronavirus that is presenting many uncertainties, because we do not know how it works, how it affects and what kind of risk that the people will face, because it continuously changing, mutating into various forms, and it is affecting all the individuals in different forms. So there are many uncertainties we have, and none of us can completely eliminate from the risk of getting infected with COVID-19. So what we can do, one thing we can do in our hands, in all our hands. Our diet is modifiable factor. It's totally in our hands. So one thing we can do is eat as healthy as possible. So apart from this, you also follow all the protective measures that the government is saying with regard to wearing the mask and hygiene and sanitation, social distance, everything. Take care of all the things in your daily life. And I can conclude with giving very important tips for normal maintaining your normal health to face the COVID-19 problem in future. So how to protect ourselves from COVID-19, as well as if in post COVID-19 you can continue to take these nutritional recommendations until you are becoming very healthy and fit. Always eat variety of foods, take balanced diet, and at least every individual you just have at least 500 grams of fruits and vegetables every day, and always use fresh foods, all the foods, not only fruits and vegetables. Try to eat fresh foods, don't depend on processed foods, and avoid junk foods totally, because it is very harmful for the body. If anybody are habituated to smoking and drinking, just avoid smoking and drinking, and always hydrate yourself. Drink at least 2 to 3 liters of water every day. And if you are still suffering with sore throat and cough even after COVID, you try to sip warm water, at least 8 to 10 cups of warm water throughout the day, and take more fluids like coconut water or buttermilk or barley water, any kind of fluids. Try to take more fluids, and you can just restrict the trans fat. Don't take trans fat. Instead of it, you take very healthy fat, different kinds of oils you just incorporate into your cooking. And protein is very important. Whatever the protein source that is available to you and affordable to you, try to take more protein in your diet, and reduce salt intake, because we healthy individual, we required not more than 5 grams of salt is required for each individual, and they don't take too much of salt, and try to avoid white sugar. Instead of white sugar, you just habituate to either jaggery or honey if you are non-diabetic. You can prepare your sweets and other recipes with either jaggery or honey instead of white sugar. Try to just restrict the amount of white sugar and salt. Apart from all these nutritional tips, you just be away from the stress. Don't scared about the COVID-19 situation. You just be strong and do some exercise regularly, and try to learn pranayama and yoga, and adapt pranayama and yoga every day. That will help for effective breathing. And sleep is very, very important. Sleep is having a lot of role, very significant role in our immune system. Try to sleep at least 8 hours. So these are all the simple tips that we have to follow to because overcome with COVID-19 symptoms easily, and we can have a regular health and fitness soon. And the best way, as a nutritionist, I can once again say that the best way to boost your immune system is to include foods which are rich in nutrients and vitamins. Try to include natural foods. Don't depend on supplements unless your body is deprived of certain vitamin or minerals, then only you take supplements under the supervision of your doctor. Otherwise you can take all the vitamins and nutrients only from the natural food, because supplements can be detrimental, because many supplements lead to toxicity. It is very harmful for the body. So don't take on your own, particularly zinc and iron and vitamin E, even vitamin D. Don't take on your own. If really required, you take supplements. Otherwise, all the food, all the nutrients which are essential for our immune system is plentifully available in our foods. Nature is giving all the foods which are essential for our health and wellness. Try to make certain kind of modifications and stay safe and healthy. Thank you.
Thank you, madam. Thank you very much. So I think all the participants have learned so much information about our healthy life during this COVID. So if anybody wants to have further clarification, they can have directly interact with the madam. Prashant, please unmute all the participants.
Yes, sir.
Yeah, please. Anybody to Masharu? Hello.
Yeah, done, sir.
Yeah, Kumar Swami garu. You're already hand raise చేశారు.
Good evening, sir. Good evening, madam garu.
Good evening. Madam,
Good evening.
madam.
Good evening, Andy. Kumar Swami garu.
సార్ వెరీ ఎక్సలెంట్. మాకు ఈరోజు వెబినార్ జరిగింది, చాలా ఇన్ఫర్మేటివ్ గా ఉంది. అండ్ ఇది లిటిల్ బిట్ లేట్ అయిందని మేము అనుకుంటున్నాం. ఇది కొంత ఒక 1 month 2 months బిఫోర్ ఇట్లాంటిది మీటింగ్ అయ్యి ఉంటే ఇంకా చాలా లైఫ్స్ కి మేము కొంతవరకు ఉపయోగపడే విధంగా ఉండేది అనుకుంటున్నాం. ఎక్సలెంట్ మేడం, చాలా బాగుంది. చిన్న డౌట్ మేడం గారు,
చెప్పండి.
ఇప్పుడు మీరు చెప్పినట్టు మాక్సిమం న్యూట్రిషన్ డైట్ మొత్తం అంతా టోటల్ గా ఏదైతే బాడీకి ఇమ్యూన్ సిస్టాన్ని ఇంక్రీజ్ చేస్తుంది అనేటటువంటిది చాలా ఎక్సలెంట్ మ్యాటర్ ఇవ్వడం జరిగింది మీరు. అయితే ఇప్పుడు బయట మనకి కొన్ని రకాలైనటువంటి స్టోరేజ్డ్ రెడీ ఫుడ్ అంటే పౌడర్ రూపాన కొంత న్యూట్రిషన్ ఫుడ్ అనేటటువంటిది చాలా వరకు ప్రాపగేట్ అవుతుంది. చాలా మంది దాన్ని వినియోగిస్తున్నారు అప్పుడున్న. అంటే అంటే మన లంచ్ అంటే బ్రేక్ఫాస్ట్, లంచ్, డిన్నర్ తో లంచ్ యాజ్ యూజువల్ గా తీసుకున్నప్పటికి కూడా కొన్ని ప్రిజర్వేటివ్ ఫుడ్ అంటే పౌడర్ రూపాన అన్ని న్యూట్రియంట్స్ తో ఉండేటటువంటి న్యూట్రిషనల్ ఫుడ్ అనేటటువంటిది మార్కెట్ లో ఉంటుంది. అది ఎంతవరకు సజెస్టబుల్ హ్యూమన్ బీయింగ్ కి ప్రెసెంట్ ఉండేటటువంటి వాటికి అది ఏ రకంగా ఉపయోగపడుతుంది, కొంచెం క్లారిటీ కావాలి మేడం. మీకు తెలిసే ఉంటుంది అనుకుంటా.
కుమారస్వామి గారు, ఇప్పుడున్న సినారియోలో బికాస్ అర్బనైజేషన్ అండ్ మోర్ వర్కింగ్ విమెన్, సో ఇలాంటి సిచ్యువేషన్ లో మెనీ ఆఫ్ ద ఫ్యామిలీస్ మనము ప్రొడక్ట్స్ డిపెండ్ అవుతున్నాం. సో ఆ ప్రొడక్ట్స్ ఎంతవరకు సేఫ్ అంటే, ఇఫ్ యూ హ్యావ్ టైం, మీకు ఇంట్లో టైం ఉంటే మనం ప్రిపేర్ చేసుకోగలిగితే ఇంకా అంతకన్నా మంచి అడ్వైస్ అనేది ఉండదు. అలాంటి టైం లేదు, మనకు వేరే ఆప్షన్ లేదు, మనం బయట నుంచి కొనుక్కోవాలి అనుకున్నప్పుడు సో ఫుడ్ లేబుల్, న్యూట్రిషన్ లేబుల్ చదవడం అనేది అలవాటు చేసుకోండి. సో మీరు అన్నారు పౌడర్స్, అవును, హెల్త్ మిక్స్లు కానీ ఇలాంటివి చాలా దొరుకుతున్నాయి మార్కెట్ లో. అవన్నీ కూడా న్యాచురల్ ఫుడ్స్ తో చేసినవి అయితే వాటిని ప్రిఫర్ చేయండి. అది కూడా మీకు ఇంట్లో తయారు చేసుకునే అవకాశం లేదు, ఫెసిలిటీ లేదు అనుకున్నప్పుడు మీరు వాటిని వాడచ్చు, ప్రాబ్లం లేదు. ఇప్పుడు కొన్ని న్యూట్రిషన్ ప్రోడక్ట్స్ ఈ మధ్య కాలంలో వింటున్నాం ఏంటంటే ఫాస్ట్ గా వెయిట్ రెడ్యూస్ చేసేవి అండ్ ఫాస్ట్ గా న్యూట్రిషన్ ప్రోడక్ట్స్ అనే పేరుతో మార్కెట్ అవుతున్నాయి. దట్ పర్టికులర్ ప్రోడక్ట్స్ ఆర్ నాట్ అడ్వైజబుల్ అండి. రెగ్యులర్ సూపర్ మార్కెట్ లో దొరికే కన్వీనియంట్ ప్రోడక్ట్స్ ఉన్నాయి, వాటిని మనకు వేరే ఆప్షన్ లేదు అన్నప్పుడు వాటిని మనం వాడుకోవడంలో ఏం ప్రాబ్లం లేదు. బట్ ట్రై టు రీడ్ ద లేబుల్. టూ మచ్ ఆఫ్ అడిటివ్స్ అండ్ ప్రిజర్వేటివ్స్ అనేవి ఉన్నాయా అనేది ఒకసారి చెక్ చేసుకొని వాడుకోవచ్చు.
థ్యాంక్ యూ మ్యామ్. వన్స్ అగైన్ మన చిన్న డౌట్ మేడం.
చెప్పండి.
ఇప్పుడు ఇమ్యూన్ సిస్టమ్ లో మనకి వీకెన్ అయింది అంటే మనకి కొన్ని రకాలైనటువంటి సిమ్టమ్స్ వల్ల మన ఇమ్యూనిటీ సిస్టమ్ ప్రతిసారి మనం పెథాలజీకి వెళ్ళి మనకి విటమిన్ డెఫిషియన్సీ లేదంటే సంథింగ్ ఇంకా ఏమైనా డెఫిషియన్సీ ఉండడం అనేటటువంటిది మనం పెథలాజికల్ ల్యాబ్కి వెళ్ళి టెస్ట్ చేయించుకునే కంటే మనకు గానే ఇమ్యూన్ సిస్టమ్ డౌన్ అవుతుంది అంటే మనకి వీక్ గా అవుతుంది అనే సిమ్టమ్స్ ఏమైనా ఉన్నాయా మేడం గారు? ఇమ్యూన్ సిస్టమ్ బాగా బెటర్ గా ఉంది లేదంటే లో లెవెల్లో ఉంది అనే విషయం ఏమైనా మనకుగా మన సిమ్టమ్స్ బట్టి తెలుసుకోగలమా?
అంటే ఇమ్యూన్ సిస్టమ్ ఒక్కొక్క పర్టికులర్ ఆర్గాన్ మీద ఒక పర్టికులర్ ప్రాబ్లం మీద డిఫరెంట్ గా చూపిస్తుందండి. అండ్ కామన్ ఇండివిజువల్స్ ఏంటంటే మనకు ఒక సీజన్ లో వచ్చే జనరల్ ఫ్లూస్ కానీ అండ్ జనరల్ కోల్డ్ అండ్ ఫ్లూస్ మీరు అవాయిడ్ చేయగలుగుతున్నారు బాగా అనుకుంటే మీరు పర్ఫెక్ట్ ఇమ్యూన్ సిస్టమ్ తో ఉన్నట్టు. బట్ ఇమ్యూన్ సిస్టమ్ రకరకాలుగా ఎఫెక్ట్ అవుతుందండి. నాట్ ఓన్లీ విత్ కమ్యూనికబుల్ ప్రాబ్లమ్స్ లైక్ కోల్డ్, కాఫ్, మనకి ఇలాంటి కరోనా వైరస్ ప్రాబ్లం ఇలాంటివి కాకుండా ఇమ్యూన్ సిస్టమ్ ఎఫెక్ట్ అయితే సో లాట్ ఆఫ్ ప్రాబ్లమ్స్, అదర్ కైండ్ ఆఫ్ ప్రాబ్లమ్స్ కూడా ఉంటాయి. వాటికి సమ్ టైమ్స్ మెనీ డేస్ అవి అసిమ్టమాటిక్ గా కూడా ఉంటాయి. కాబట్టి ఇమ్యూన్ సిస్టమ్ స్ట్రాంగ్ గా ఉండేదానికి ఏం లేదండి. మీరు బాగా పర్ఫెక్ట్ గా బ్యాలెన్స్డ్ డైట్ తీసుకుంటూ ఫిజికల్ యాక్టివిటీ యాక్టివ్ గా ఉంటూ అట్లీస్ట్ 30 to 1 hour ఎక్సర్సైజ్ చేస్తూ ఉంటే వీఆర్ వెరీ ఫిట్. అండ్ రెగ్యులర్ గా ఫ్రీక్వెంట్ గా మీరు కామన్ సీజనల్ ప్రాబ్లమ్స్ కి ఎఫెక్ట్ కాకుండా ఉన్నారు అంటే మీరు పర్ఫెక్ట్లీ ఇమ్యూన్ సిస్టమ్ బాగుందనే.
థ్యాంక్ యూ వెరీ మచ్ విలాసరావు గారు, చాలా చాలా థ్యాంక్స్ సార్. చాలా ఎక్సలెంట్ వెబినార్ ఇది. అపర్ణ మేడం గారికి కూడా మా డీసీలు అందరి తరఫున కూడా ప్రత్యేకమైనటువంటి కృతజ్ఞతలు, ధన్యవాదాలు తెలియజేస్తాం సార్. థ్యాంక్ యూ
వెరీ మచ్. సో మేడం ఈ రోజు కవర్ చేసినవి ఏంటంటే రోగ నిరోధక శక్తి కాకుండా విటమిన్ డి, విటమిన్ ఇ, విటమిన్ సి ఇవి నేచురల్ గా ఎక్కడ దొరుకుతాయి, హౌ ఐరన్ అండ్ జింక్ ఇవి బి కాంప్లెక్స్ టాబ్లెట్స్ జనరల్ గా వాడేస్తున్నా కానీ అది ఎంతవరకు బూస్టప్ చేస్తాయి మన ఇమ్యూనిటీని అన్నది ఏంటంటే చాలా విపులంగా తెలియజేశారు. సో మీరు అన్నట్టుగా ఏంటంటే మేడం అపర్ణ మేడం ఏంటంటే ఎప్పుడో పెడదామని అన్నారు. బట్ డ్యూ టు వేరియస్ అదర్ రీజన్స్ వల్ల ఏంటంటే మేము ఈ ప్రోగ్రామ్ ఏంటంటే ఒక 15 to 20 days కొంచెం డిలేగా కమ్యూనికేట్ చేయడం జరిగింది. సో ఎనీవే కొంత ఈ సమయంలోనే మనం ఈ యాక్టివిటీని చేస్తాం. కొంత యాక్టివిటీస్ చేస్తాం. సో థ్యాంక్ యూ సో మచ్ మేడం. మీరు ఇంకెవరైనా ఉన్నారా ప్రశాంత్? హ్యాండ్ రైజ్ చేసిన వాళ్ళు కానీ లేదంటే ఇంకేమైనా స్పీక్ క్వరీస్?
yes sir, 2 more questions ఉన్నాయి సార్.
ప్లీజ్ alert them once again.
సార్ డివి సుబ్బనాయుడు గారు ఫ్రమ్ వైఎస్ఆర్ కడప డిస్ట్రిక్ట్ సార్.
సుబ్బనాయుడు గారు. సుబ్బనాయుడు గారు టీచర్ రైట్ ఇంతవరకు ఎందుకు ఏమైనా క్వశ్చన్ వేయలేదని చూస్తున్నాను నేను.
సార్ సార్ క్వశ్చన్ ఏంటంటే సార్, వాట్ డిస్ట్రాయ్స్ ఇమ్యూన్ సిస్టమ్?
వాట్ మేడం? మేడం will answer directly.
What destroys immune system?
What destroys immune system? Already I told you that there are many factors behind that. Very important one are your faulty dietary habits. And if you have lack of exercise, if you have under stress, physical stress or mental stress that you have, or if you have any faulty habits like smoke or taking alcohol, and lack of sleep, in recent years lot of research is going on with regard to sleep and immunity. Weaken immune system. So these are all various things that weaken your immune system. And environmental pollution is also playing major role in recent years in weakening our immune systems.
Thank you madam. Now Hamid Kumar. Please.
Madam, namaste, madam.
Namaste, Andy.
Madam, we observe some persons who have been discharged from the hospital after COVID. Prior to COVID, they are not diabetic. After COVID, they are identified as diabetic. And could you please explain the reason and remedies, madam? One more question is,
Sir.
for this diabetic, recently I have read in one article that 16/8 system of eating, that is 16 hours intermittent fasting and 8 hours of eating window, will help very better. Can you please guide us in this regard?
Yeah, sure, sir. Actually, this COVID-19 induced diabetes that we are seeing in many individuals, because the medication that the health professionals are using to overcome the symptoms, because few people are suffering with very critical kind of symptoms. In that particular situation, they have to give steroids and other kind of drugs, which is playing major role in metabolism of our system. మన మెటబాలిజం అనేది ఎఫెక్ట్ అవుతుంది కాబట్టి అప్పుడు ఆ COVID-19 వల్ల డయాబెటిక్ అవుతున్నారు పీపుల్, బట్ ఇట్ ఈస్ నాట్ పర్మనెంట్ అండి. సో ఆఫ్టర్ డిశ్చార్జింగ్, ఇఫ్ యూ ఫాలో a very healthy lifestyle, very systematic lifestyle, by following proper diet and exercise, then adi actually you can recover from COVID-19 induced diabetes andi, no problem. And coming to intermittent fasting, అది చాలా పెద్ద సబ్జెక్ట్ అండి. ఇంటర్మీడియట్ ఫాస్టింగ్ అనేది నేను ఫారే, బికాస్ మెనీ బెనిఫిషియల్ ఎఫెక్ట్స్ ఉన్నాయి ఇంటర్మీడియట్ ఫాస్టింగ్ కి. మేము న్యూట్రిషనిస్ట్ చాలా కేసెస్ లో ఇంటర్మీడియట్ ఫాస్టింగ్ ని సజెస్ట్ చేస్తున్నాము అండ్ యూస్ చేస్తున్నాము. బట్ కమింగ్ టు COVID-19, ఇట్లాంటి సిచ్యువేషన్ లో ఏమవుతుందంటే వీ హ్యావ్ టు ప్రొవైడ్ the energy and calories throughout the day, because for proper functioning of immune system కాబట్టి మీరు రికవర్ అయినా కూడా మీరు నార్మల్ హెల్త్ కండిషన్ లోకి వచ్చే వరకు డోంట్ గో ఫర్ ఫాస్టింగ్. బట్ ఆఫ్టర్ దట్ తర్వాత ఫాస్టింగ్ అనేది అన్ ఎక్సలెంట్ రెమెడీ ఫర్ ప్రాపర్ ఫంక్షనింగ్ ఆఫ్ అవర్ ఇమ్యూన్ సిస్టమ్ అండి. మీరు హెల్తీగా ఉన్నారు, నార్మల్ లైఫ్ లో ఉన్నారు, ఫిట్ గా ఉన్నారు అనుకుంటే మీరు డెఫినెట్ గా ఫాస్టింగ్ అనేది అట్లీస్ట్ వీక్లీ 1 day మీరు ఫాస్ట్ లో ఉంటే ఇమ్యూన్ సిస్టమ్ చాలా బాగా ఎఫెక్టివ్ గా వర్క్ చేస్తుంది.
Not weekly fasting, madam. That intermittent fasting of 16 hours and eating in 8 hours.
ఇంటర్మీడియట్ ఫాస్టింగ్ వచ్చేయండి మీరు అండర్ ద గైడెన్స్ ఆఫ్ డైటీషియన్ తీసుకోవాలండి, బికాస్ పర్టికులర్లీ COVID-19 లో న్యూట్రిషనిస్టులు సజెస్ట్ చేయట్లేదండి ఇంటర్మీడియట్ ఫాస్టింగ్. మీరు రికవర్ అయిన తర్వాత మీరు ఫాలో అవ్వచ్చు. బట్ డైట్ చార్ట్ ని మీరు ఫస్ట్ ఎనీ డైటీషియన్, రిజిస్టర్డ్ డైటీషియన్ దగ్గర నుంచి కానీ న్యూట్రిషనిస్ట్ దగ్గర నుంచి కానీ తీసుకొని ఫాలో అయ్యి దాన్ని కంటిన్యూ చేసుకోవచ్చు.
Okay, ma'am. Thank you.
Thank you, Hemant Kumar garu. Thank you very much, madam. So many professors also joined this webinar. Are there anybody from professors or academicians? If you want to say anything to madam, you can. You are welcome, sir. Prashant.
Yes, sir. No one, sir, but one more question is there, sir.
Yeah. Yoru?
Another question is there, sir.
Yeah, please.
Madam, are artificial sweeteners better than sugar? Madam, is a question.
No, అండి. యాక్చువల్లీ ఆర్టిఫిషియల్ స్వీటనర్స్ కొన్ని సర్టెన్ కండిషన్స్ లోనే తీసుకోవాలండి. నాట్ ఎట్ ఆల్ గుడ్ వెన్ కంపేర్ టు ద న్యాచురల్ ఫ్రూట్ అండి. ఇఫ్ యు ఆర్ హెల్తీ యూ కెన్ హ్యావ్ యువర్ స్వీటనర్, న్యాచురల్ స్వీటనర్. సో వైట్ షుగర్ ని అవాయిడ్ చేసి మీరు ఏదర్ బ్రౌన్ షుగర్ ఆర్ జాగరీ, హనీ ఇలాంటివి ఇంక్లూడ్ చేసుకోండి. ఆర్టిఫిషియల్ స్వీటనర్స్ ఓన్లీ డయాబెటిక్స్ కి అండ్ వెరీ స్ట్రిక్ట్ వెయిట్ రిడక్షన్ డైట్స్ లో ఇలాంటి చోట్ల మాత్రమే వాడుతున్నారు. బట్ టూ మచ్ ఆఫ్ ఆర్టిఫిషియల్ స్వీట్నెస్ ఆర్ నాట్ ఎట్ ఆల్ గుడ్ ఫర్ హెల్త్ అండి.
Okay. Thank you, madam. So, madam again emphasized on yoga and pranayama, which is being adopted by our India. So this is everywhere we have to follow for our healthy life, and as you have given also tips for our healthy life. So థ్యాంక్ యూ వెరీ మచ్ మేడం. బట్ మన పార్టిసిపెంట్స్ అన్నట్టుగా ఏంటంటే ఇది కొంత ఒక 1 month బిఫోర్ కానీ పెట్టుంటే కనుక ఇంకా ఎంతో మంది లైఫ్ మనం సేవ్ చేస్తుండే వాళ్ళమేమో, కానీ నెవర్దెస్ లేట్. సో ఎప్పటికైనా కొంతమంది రియలైజ్ అయ్యి వీటిని ఫాలో అయితే దే కెన్ సేవ్ దేవర్ లైఫ్స్ అండ్ ఫ్రెండ్స్ లైఫ్స్ అండ్ ఈవెన్ దేర్ ఫ్యామిలీ మెంబర్స్ లైఫ్స్. సో మీకు మీ ఈ కార్యక్రమంలో పార్టిసిపేట్ చేసేందుకు అప్రాష్ తరఫున, తర్వాత పార్టిసిపేట్స్ తరఫున, డిస్ట్రిక్ట్ కోఆర్డినేట్స్ తరఫున, అందరి తరఫున ప్రత్యేక కృతజ్ఞతలు తెలియజేసుకుంటున్నాం మేడం. సో మా మెంబర్ సెక్రటరీ గారు కూడా ఇప్పుడే మేము మాట్లాడడం జరిగింది. సో వారు కూడా ఏంటంటే వారి విషెస్ ని మీకు అందజేయమని చెప్పారు. సో బై దిస్ వే వీఆర్ వెరీ మచ్ థ్యాంక్ఫుల్ టు యూ. By the way, madam is also AP Scientist Awardee issued last year not last year, this year only, March 22nd organized చేసిన program లో she was one of the awardee from Andhra Pradesh. So congratulations once again, madam. Thank you for your valuable time spent with our participants and given beautiful very informative information about health during our COVID pandemic situation. Thank you, thank you, Varana. You can leave participants. Evaru maatladtara? Punnaya garu maatladtara? Okay. With this, we conclude, madam. Thank you very much.
Sir, from my side, yeah. Thank you very much for Aparna ma'am, Dr. Aparna ma'am, member secretary, and you, Dileshwara sir, the project officer, and I also thank Ravi Teja and Prashant continuously with me since past 2 weeks, and they are helping me to connect with the webinar. And Ravi Teja and Prashant, thank you very much. And I thank all the participants because for patient listening in evening. Thank you very much, one and all.
Thank you. Prashant, you can conclude. You can close this session.
Okay, sir.